About the primitive streak and the germ layer derivatives. After gastrulation, we have seen there are some germ layers formed and we want to know their derivatives now. So here what we notice is this is the dorsal amniotic cavity, ventral is the yolk sac cavity where we had the epiblast migrating downward and undergoing the process of gastrulation, where they were moving towards the ventral side at the roof of the yolk sac cavity forming the endoderm. In the middle they will form the mesoderm, whereas on the dorsal aspect they will form the ectoderm. Now what we have done is we have taken a longitudinal section of the embryo where all the three germ layers are evident. This side is cranial or cephalic and that side is caudal or the tail end of the baby. So we can mention here this side is the cranial or the anterior end, whereas this is the caudal or the posterior end. And we can see the dorsal amniotic cavity, the ventral yolk sac cavity, where the ectoderm is lying at the floor of the amniotic cavity, as is evident here. On the roof of the yolk sac cavity will have the endoderm, as we can show, and between the two will be the middle layer, that is the mesoderm. In this diagram, the mesoderm is shown to have formed the notochord. The mesoderm is giving several derivatives and one of the derivative is the notochord. We also notice towards the cranial end of the baby, the ectoderm and endoderm have fused with no intervening mesoderm and we are calling it as buccopharyngeal membrane, whereas on the caudal end of the baby, the ectoderm and endoderm has fused and forming what is called as the cloacal membrane. We have to understand that may it be the cloacal membrane as evident here, or may it be the buccopharyngeal membrane. Both of them are having the fusion of ectoderm and endoderm with no intervening mesoderm. That comes as one of the MCQ. And we should know that this notochord, which is formed by the mesoderm but itself coming from the epiblast, because it is the epiblast which is going to form all the three germ layers, may it be the endoderm, mesoderm or ectoderm, it is the epiblast which is more specific answer for the formation of the notochord. And this notochord is important because it is going to stimulate the overlying ectoderm so that it will turn into neuroectoderm and form the nervous system. If you remove the notochord, then ectoderm is not going to change into neuroectoderm and there is no formation of nervous system. Now we already have seen this diagram where we mentioned it is a proliferation of the epiblast which will be going to form the primitive streak, and primitive streak starts forming from the caudal end towards the cranial end. We are going to look at the formation of primitive streak in a later stage, and what we are doing is looking from the dorsal view, that is at the floor of the amniotic cavity, and we are turning this disc in such way that whatever we are telling anterior here is going in this direction and whatever we are telling posterior is coming in downward direction. So anterior goes up and posterior goes down. So this is the dorsal view of the developing baby. We are looking at the cranial end or the anterior end, and this is going to be the posterior end or the caudal end. It is from here that the primitive streaks start forming, and before we see these cloacal membrane or the buccopharyngeal membrane, the very first thing which appear is the procaudal plate. So as we see, this is the procaudal plate which appears quite early and is going to decide that this end of the baby is the cranial end or what you can call as the anterior end, and respectively on the opposite pole will be the posterior or the caudal end of the baby. So here we are mentioning this is the posterior or the caudal end, and it is after that we start talking about the primitive streak. Proliferation of the epiblast cell to form the primitive streak, starting from the caudal end and moving towards the cranial end, and this primitive streak will have three components. As you can see, this is the primitive streak we are talking about, having a groove and a pore and a knot. So here is the primitive groove as we see. Then we have our primitive knot, which is also called as the Hansen's node, and then in the Hansen's node we have an opening which we are calling as the blastopore or the primitive pore. We are going to make this diagram ourselves as well, where we will find that the epiblast cells which were at the floor of the amniotic cavity, they were proliferating to form this primitive streak, and then they are moving inside this pore and going ventral. As they go ventral, they will be forming the first germ layer, that is the endoderm, and as they keep going down, they will form the next layer, which is the mesoderm, and then the epiblast cells, which are not moving at all, themselves will be converted into the ectoderm. And some of the epiblast cells, they are moving down the primitive pore and go towards the procaudal plate. So it is the middle layer. It is kind of a mesoderm, but we are calling it as the notochord. We also notice that there will be a formation of buccopharyngeal membrane and a cloacal membrane, which is due to the fusion of the dorsal lying ectoderm and ventral lying endoderm with no intervening mesoderm. Let us draw this diagram ourselves now. So as we understand, we have known that if this is the developing embryo, on the dorsal side there is amniotic cavity, ventral is the yolk sac cavity, and there were epiblast cells at the floor of amniotic cavity, whereas hypoblast cells at the roof of the yolk sac cavity. Then the epiblast cells, they were migrating downward ventral so that they are going to form the three germ layers. The process is called gastrulation, and this movement is what we are going to talk about, which is formation of the endoderm, mesoderm, and the ectoderm, ingression of the epiblast cell. But the view which we are going to take is the dorsal view of the embryonic disc. We have known that the baby is in the form of a disc, and that is what we are drawing now. So as we are talking about the dorsal view of the embryo at the floor of the amniotic cavity, it is all covered by the cells which are called as the epiblast cells. We will mention them here, and then there occurs one event which will be one thickening developing here called as the procaudal plate. And wherever this thickening develops, procaudal plate, it decides the axis of the baby. This end will become the cranial or anterior end, and on the opposite pole that will be the posterior or the caudal end. Let us mention it here. So this is going to be the anterior or the cranial end, and this is going to be the posterior end. Then by the end of the second week, there is proliferation of these epiblast cells and they form primitive streak. This primitive streak is having three components which we are going to talk about now, and it is starting from the caudal end, moves towards the cranial end. It has a caudocephalic direction, which you can show by the arrow mark here, caudocephalic. And the three components of the primitive streak are, there is a primitive node which is also called as the Hansen's node, and in that there is a primitive pit or what is called as blastopore also, and then there is a groove, the primitive groove. So here is the primitive groove, this is the Hansen's node, and in the Hansen's node we are seeing a pit which is also called as the blastopore. What happens is the epiblast cells, they will be migrating and jumping into this pit so that they go ventral towards the roof of the yolk sac and form the first germ layer in the disc which is called as the endoderm. So let us look at the migration of these epiblast cells here. This is the process of gastrulation, which is ingression of the epiblast cells towards the ventral side and form the very first germ layer, which is the endoderm. But they continue moving downward and then form another layer, which is the middle layer, the mesoderm, which you can show here. And then the epiblast cells, which are not migrating at all, will be converting themselves into the ectoderm. Formation of three germ layers in the third week by a cell which is called as the epiblast cell. And then we notice some of the epiblast cells, as they are going into the primitive pit, they move cranial and they will form what is called as the notochord, the axial mesoderm. So let us show them here. Some of the epiblast cells which have migrated down from this pit are going to form this notochord. This notochord is also called as the axial mesoderm, and maybe that is why this plate was called as precaudal plate, as it is prior to the notochord. This axial mesoderm is important because it will be stimulating the overlying ectoderm to form the neuroectoderm. In the periphery there is surface ectoderm, and if somehow you remove the notochord, the central neuroectoderm may not form, nervous system may not form. Then we can also mention in front of the procaudal plate we have the buccopharyngeal membrane, whereas on the posterior side we'll have the cloacal membrane. And these membranes, as we talk about them, may it be the buccopharyngeal membrane or the cloacal membrane, there is fusion of ectoderm and endoderm, and these membranes, they have no intervening mesoderm. As I mentioned, it comes as a question.